Welcome to The Explainer. Today, we're digging into the science of reproductive pharmacology. We're going to look at how some really common medications work with our body's own internal programming, how they're used every day, and most importantly, why knowing the rules of this system is so critical for your health.
So, here's the plan. We'll start with the absolute basics, the hormones that run the whole show. Then, we'll get into the modern contraceptive toolkit and see how these same principles help us manage other common health problems. And we'll wrap things up with a super important note of caution, but you're definitely going to want to stick around for. Okay, let's dive right in. See, to really get how these medications work, you first have to understand the body's own software. It's kind of like thinking of your reproductive system as this incredibly complex operating system, and it's all run by these powerful little chemical signals we call hormones. So these hormones, they're basically the code that tells our bodies what to do. They're the absolute foundation of the reproductive system, and they control everything from puberty and development all the way to fertility and pregnancy. They're like the body's own internal instruction manual. Now, there are a lot of hormones, but the two main players on the field are estrogen and testosterone. Estrogen, that's the primary female sex hormone. It's in charge of female characteristics and getting the uterus ready for a potential pregnancy. On the other side, you've got testosterone, the main male sex hormone, which is all about developing male characteristics and firing up sperm production. Each one has a totally distinct job to do. All right, so now that we have the basics down, let's look at one of the most common reasons we intentionally step into this system, managing fertility. This is where pharmacology lets us, essentially, reprogram the body's default settings to prevent a pregnancy from happening.
And the toolkit we have today is amazing. It's so diverse, which is really the key to finding something that works for your life. You've got daily options like the pill, weekly ones like a patch that sends hormones through your skin, and even super long-acting methods like an IUD that can work for years or an injection that lasts for months. That range means people can find a method that actually fits their lifestyle.
And this is a perfect example of just how precise these programs need to be. The patch, for instance, runs on a super strict 4-week cycle. You put on a new one every week for 3 weeks straight, and then that 4th week is patch-free. It's that exact timing, that specific set of instructions that makes it work. So here's the deal, and this is crucial. As amazing as these tools are, they come with some really important rules and risks. You have to know that hormonal contraceptives do not protect you from STDs. If you're a smoker, the risks of heart problems go way up. And other drugs, even some common antibiotics, can actually make them less effective.
But it's not all about preventing pregnancy. The same science, these same ideas about managing hormones, are also absolutely essential for treating all sorts of other health conditions that pop up in the reproductive system.
For men, especially as they get older, a really common issue is something called benign prostatic hyperplasia, or BPH. All it means is that the prostate gland gets bigger, but it's not cancerous. The problem is, because the prostate wraps around the urethra, when it swells, it can squeeze it and make something as simple as going to the bathroom pretty difficult.
Treatment for BPH is actually a great example of a clever 1-2 punch in pharmacology. Doctors have drugs called alpha blockers that work fast, relaxing the muscles right around the prostate to give you quick relief. Then, for the long game, they use other drugs called 5-alpha reductase inhibitors that work over a few months to actually shrink the prostate itself.
And of course, we can't talk about this stuff without bringing up another huge topic, erectile dysfunction, or ED. And you just can't discuss ED without mentioning one of the most famous drugs in the world, sildenafil, which pretty much everyone knows by its brand name, Viagra. But here's the wild part, the story behind Viagra. It was a complete accident. Seriously, scientists were first testing sildenafil to see if it could lower blood pressure and treat angina. That's a type of chest pain. Its now famous side effect, that was just a surprise discovery during the clinical trials. A happy accident, you might say.
Now, shifting back over to women's health, this science is also a lifeline for managing really painful conditions like endometriosis. This is something that affects about 1 in 10 women around the world. It's when tissue that's like the uterine lining starts growing where it shouldn't, outside the uterus. And that can cause chronic pain, inflammation, and can even impact fertility. So again, hormone-based meds are a key part of the strategy here. Okay, this brings us to our last section, and honestly, it might be the most important one. These medications are incredibly powerful tools, but as the saying goes, with great power comes great responsibility. We have to be so careful with how they're used, especially when they're mixed with other drugs.
So that leads us to the million-dollar question. We know they work, but can they be dangerous when they interact with each other? Let's just walk through a quick real-world example to see just how high the stakes can be.
So here's our scenario. We have a 55-year-old man. He's being treated for diabetes and high blood pressure, and he's on 4 regular medications: metformin, atenolol, atorvastatin, and isosorbide dinitrate. All very common prescriptions.
Okay, now his doctor also prescribes him Viagra for ED. Looking at his medication list, one of those drugs creates a really dangerous, potentially life-threatening interaction. Take a look. Can you spot the conflict?
All right, did you figure it out? If you pointed to the isosorbide dinitrate, you are spot on. That's the one that causes a huge problem.
And here's why it's so incredibly dangerous. Isosorbide dinitrate is what's called a nitrate, and it's often used for chest pain. Here's the thing. Both nitrates and Viagra do the same basic job. They both relax and widen your blood vessels. When you take them together, you're not just adding their effects, you're multiplying them. And that can cause a sudden, massive, and potentially fatal drop in blood pressure.
Which really just leaves us with this final thought to chew on. Understanding our body's biological code gives us incredible power. But as we get better and better at writing new software, these new medications, to tweak that code, the single biggest challenge becomes making sure that all these different programs we're running can actually play nicely together without causing a total system crash.